Hi, this is Dr. Pavan Sagar. If you've been following my YouTube channel for the past few days, you might know that I've been talking about liver. So I've been giving a lot of importance to what is a liver, what are its functions, and how you can improve or preserve your liver's health, and also how you can reverse your fatty liver disease. So, in today's video, I'll be talking about 5 things that people are doing which might be causing fatty liver disease. Now, to understand what is fatty liver disease is very easy. It is just excessive accumulation of fat in your liver. And there are 5 main things that people might be doing which are leading to fatty liver disease. The most common problem people who suffer with fatty liver disease is the food habits that they have. So these people who have fatty liver disease are usually eating at wrong time and eating the wrong things, meaning they eat a lot of fried food, that is food that are rich in fat, food that are rich in sugar, and food that are rich in carbohydrates. Now these foods will not keep you full for longer period of time, which makes you get into this cycle of eating again and again during the day. Now what happens is that you will develop something called as insulin resistance. When you develop this insulin resistance, you'll be able to notice that you are eating the same amount of food, but you are gaining weight. You've started becoming obese. So this is one of the signs that you can be sure that you are developing or you've already developed insulin resistance. Now because of this insulin resistance, what happens is that you might become pre-diabetic or diabetic very soon, and this also puts a burden on your liver, and that's when your liver starts accumulating more amount of fat, and this is called as non-alcoholic fatty liver disease, especially in people who do not consume alcohol but still have fatty liver disease. Now the other problem with the eating habits that we have is the time when we eat. It is best and it is something very important that you eat before 7:30 p.m. in the night. You finish your dinner before 7:30 p.m. in the night. But many people do not understand this. Many people think that it is some sort of a joke when we tell people to eat early in the night, because they tell, oh, that is not possible. Oh, I have to go to work and I come home by 9 o'clock. And I tell my patients, no, you can take your food to work and you can have a meal, you can have your dinner at work. But people do not take it as seriously, and now that is one of the reasons why people are ending up in fatty liver disease and also pre-diabetes or diabetes. It is very unfortunate that India has become the capital for diabetes worldwide. This just shows that every fifth person who's being diagnosed with diabetes is an Indian, and it just makes me sad because it is very easy to solve these kind of problems, but people are not ready to take their health into their hands and take their health seriously. The main problem is that the Indian community, the Indian ethnicity are more prone to insulin resistance. So when we know that we are more prone to insulin resistance, we need to be more careful with what we eat and when we eat, because these two things are very crucial in your correction of pre-diabetes or having your diabetes under control. Because if these two are under control, your fatty liver disease will get reversed or it will be under control. So this is one of the main reasons for why many people are being diagnosed with fatty liver disease nowadays. Usually, people who have fatty liver disease are also not physically active, meaning they give very little importance to being active physically. So, you need to prioritize being active physically. Whether you want to go on a walk, you want to join a gym and work out, you want to do yoga at home, it could be anything, but you need to prioritize yourself and your health, because being physically active will make you more healthy. The problem with today's life is most of us have a desk job to do, meaning we do not get up and walk around, and this leads to more number of fatty liver disease being diagnosed because you do not eat healthy already, and on top of that, not being physically active will only add up. It is like the icing on the cake. Now, that is why I tell people to be physically active. Take walks. Walk at least 8 to 10,000 steps a day. Or if you're going to work out at least for 45 minutes every day. Go to the gym. Go and lift weights. Be physically active. And walk after you eat every meal. That is, walk for 10 minutes after you eat breakfast, lunch, and dinner. So, doing this will decrease the burden that your liver is taking because it will reduce the glucose spike that happens in your body after you eat every meal. So, when you reduce the glucose spike that is happening, you will naturally reduce the burden that the liver is taking, because even the liver cannot handle this for a long time and it will get into serious complications if the fatty liver disease is not being taken care of. So that is why being physically active is very, very important. Walking 8 to 10,000 steps or working out at the gym or at your home at least for 45 minutes a day or practicing yoga every day is very, very important. Now, that is why people need to understand that fatty liver disease can be reversed with these proactive steps of eating healthy and staying physically active. These two can definitely reverse fatty liver disease. Now, coming to a problem that is faced by many people throughout the world who suffer from fatty liver disease, and that is consumption of alcohol. Now, consuming alcohol will directly kill your liver. That's because when you drink alcohol, it gets directly converted into fat and gets stored in your liver. Once this starts happening for a long period of time, your liver will give up and it will not be able to regenerate itself or remove the toxins from the blood. This condition is called as cirrhosis of the liver. It is more or less like the end stage of the liver, and there is not much that can be done for people who suffer from cirrhosis of the liver. The other problem with these people who consume alcohol is that they usually consume it at night, and after consumption of alcohol, these people eat a rich meal, meaning they eat a lot of food that are rich in calories. Now, what happens is that this will get converted into fat again, and this will burden your liver and also increase the insulin resistance that you are already having if you are consuming alcohol. That is why if you see people who have crossed the age of 50 or 60 years and they've been consuming alcohol from a very long time, probably 30 years or 40 years, they're usually diabetic or pre-diabetic, or they will be either of these and will be suffering from fatty liver disease for sure. It is so sure that they'll be having fatty liver disease, and this is called as alcoholic fatty liver disease. Now, to counter this problem, what I tell people is to reduce the amount of alcohol intake that they do and to not drink in the night, because many people who come to me, they will not be able to leave alcohol, meaning they'll not be able to stay without drinking alcohol. So what I tell these people is that maybe on a Sunday or on a special occasion, take it preferably in the afternoon, because when you drink in the afternoon, the quality of insulin that you have in your body is better compared to when you drink it in the night. So you'll be able to digest it easily and you'll be able to give less burden to your liver. Apart from this, it is best to not consume alcohol and stay healthy, because not consuming alcohol will definitely give you a better life and a better health in general. Now, another problem with many people who have fatty liver disease is smoking. So, usually, what happens is that these people who consume alcohol are also going to smoke when they take a drink. So, that's where the problem gets worse, because smoking not only affects your lungs, it also affects your liver and your heart, because Smoking will lead to a condition called as atherosclerosis, which will directly affect your heart. And because of the toxins that get diffused into your blood, your liver gets burdened. Now, you should stop smoking, or if you're not able to stop smoking, at least reduce the number of cigarettes that you take every day, that you smoke every day. So this way you will be able to improve the quality of your life. You will be able to enjoy a healthy life and a healthy body. Now it is very important to reduce the number of cigarettes that you smoke, and it will make a big difference in your life, and you will be able to see this difference within 3 months of when you stop smoking, or when you reduce smoking, that is when you reduce the number of cigarettes that you smoke every day. The other reason why you might be suffering from fatty liver disease is because of the medicines that you're taking. It could be medicines that you might be taking for asthma, psoriasis, arthritis, certain heart diseases, or even cancer. So these kind of medical conditions demand you to take medicines for a long period of time, which will again demand your liver to work harder, and it will be a burden on your liver, for which you will end up in fatty liver disease. Now, even for these kind of people, certain lifestyle changes and dietary changes will make you have a better life and will give you a better quality of life and health. So these are the 5 reasons for why you might be having fatty liver, and I've already spoken in detail about how you can reverse your fatty liver. So I will definitely give the link for that video as well, and you'll be able to understand how you can reverse your fatty liver and how you'll be able to live healthy. Thank you so much.